From rural Doc, Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic's quad screening. What is a quad screen?
Well, it's a blood test, and it is something that you do. You can look for four different things, and it's a screen. So you're going to have high risk versus low risk on that test.
What does the quad screen test for?
Four things: alpha-fetoprotein, which is a protein produced by the baby, and it's elevated if you have something called a neurotube defect. Now, a neurotube defect, it would be an open spine or no brain. Then the second thing would be human chorionic gonadotropin, or HCG. That's the hormone of pregnancy. You take a pregnancy test, that's the thing that you're measuring. It's a hormone produced by the placenta. Then the third thing is estriol. It's urinary estriol. It's tested in the urine and also in the blood. It's a hormone. It's a form of estrogen. There are three kinds of estrogens. This is the only estrogen which is restricted to pregnancy. In other words, you will not have it unless you are pregnant. And then there's inhibin A. I'm sorry.
You got to keep thinking.
Yeah. Inhibin A, which is a hormone made by the placenta and ovaries.
When is the quad test done?
Well, it can be done anytime between 15 and 22 weeks, but the best time to do it is between 16 and 18 weeks.
What does it test for?
Down syndrome, which is trisomy 21. Well, there's different kinds of Down syndrome, but most of them are trisomy 21s. Trisomy 18, which is Edwards syndrome, and again, neurotube defects, which we talked about before.
What do the results mean?
Well, the results, this is not a test. So the answers are going to come back in terms of risk. In other words, if you have a test which, on the one hand, it might say, well, you're at greater risk for these three or four things, or at less risk or average risk. And that's the way it's going to read out. It will not give you a diagnosis.
What's the difference between a test and a screen?
Well, Neil, a screen gives you an answer, maybe. You might have this, you might not have this. A test is much more accurate. It says, yes, you do have trisomy 21. To put this in terms that we are familiar with, a pap smear is a screening test, and a biopsy is a diagnostic test. In other words, the diagnostic test is much more accurate. It's usually a little bit more risky, and it's a little more expensive. Anyway, good, thank you.
What happens if you have a positive quad screen?
Well, you can, before you take the test, your provider should explain to you the difference between a screen and a test, and you should not be confused. Again, if you have a false positive screen, you may wind up, pardon me, having a test that you don't need. So that would be unnecessary risk and unnecessary expense. On the other hand, if you have a false negative screen, which is a worse thing because that says everything is fine when it isn't, and that's the case where you would wind up with one of these illnesses and find out at the time of birth.
Is it important for me to know the difference between a screening test and a diagnostic test?
Absolutely. Again, this is something that your provider, doctor, midwife, whatever, needs to explain to you before you take the screen, because you need to understand the value of the screen. There was this young person, her name was Amanda, on ProPublica. They did a 22-page article on the fact that she had a false negative screen. In other words, the screen said she did not have an abnormal baby. In other words, the screen said she had a normal baby, and it turned out that she had a trisomy 13. And they spent a lot of time talking about the evils of these companies, but really, this is just, when all is said and done, it's just the difference between a screen and a test.
All right, the best place to go is RoyalDocAllen.com and pick up Pregnancy Your Way and Modern Medicine, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was Royal Doc Allen podcast, guys. Take care.